Question 1. A patient with heart failure is experiencing dyspnea and cough, along with a positive S3 heart sound. What is the most likely cause of these symptoms? A. Pulmonary embolism. B. Worsening heart failure. C. Acute myocardial infarction. D. Asthma exacerbation. Answer: B. Worsening heart failure. Rationale: an S3 heart sound, dyspnea, and cough are indicative of fluid overload due to worsening heart failure, often from left-sided heart failure causing pulmonary congestion. Question 2. A patient with heart failure is receiving carvedilol. Which of the following is the most important nursing assessment before administering this medication? A. Assess for hypoglycemia. B. Monitor for bradycardia. C. Check for visual disturbances. D. Assess for signs of dehydration. Answer: B. Monitor for bradycardia. Rationale: carvedilol is a beta blocker, and it can cause bradycardia. It is essential to check the patient's heart rate before administering the medication to avoid further slowing of the heart rate. Question 3. A patient with heart failure is being evaluated for a heart transplant. What is the most common contraindication for heart transplantation? A. Chronic renal failure. B. Age over 70 years. C. Severe COPD. D. Active cancer. Answer: D. Active cancer. Rationale: active cancer is a contraindication for heart transplantation due to the risk of recurrence and the impact on immune function and survival after transplantation. Question 4. Which of the following is a priority intervention for a patient with acute decompensated heart failure who has crackles in the lungs and an oxygen saturation of 88%? A. Increase the patient's fluid intake. B. Place the patient in high Fowler's position. C. Administer a bronchodilator. D. Give the patient an anti-anxiety medication. Answer: B. Place the patient in high Fowler's position. Rationale: high Fowler's position helps to improve lung expansion and ease breathing in patients with heart failure, especially with pulmonary congestion. Question 5. A patient with heart failure presents with a BP of 90 over 60 millimeters of mercury, a heart rate of 115 BPM, and a respiratory rate of 24. What is the nurse's priority action? A. Administer a diuretic. B. Administer a vasopressor. C. Perform an ECG. D. Contact the healthcare provider. Answer: D. Contact the healthcare provider. Rationale: the patient's low blood pressure, tachycardia, and elevated respiratory rate suggest worsening heart failure or shock, requiring immediate intervention by the healthcare provider. Question 6. A patient with heart failure is prescribed furosemide. What is the most important laboratory value to monitor during therapy? A. Blood glucose. B. Potassium levels. C. Liver enzymes. D. Magnesium levels. Answer: B. Potassium levels. Rationale: furosemide is a loop diuretic that can cause hypokalemia, so monitoring potassium levels is crucial to prevent cardiac arrhythmias. Question 7. A patient with heart failure has an ejection fraction of 40%. What does this indicate? A. Preserved left ventricular function. B. Severe systolic dysfunction. C. Normal cardiac function. D. Hypertrophic cardiomyopathy. Answer: B. Severe systolic dysfunction. Rationale: an ejection fraction of 40% is below the normal range, 55 to 70%. And indicates severe systolic dysfunction, characteristic of heart failure with reduced ejection fraction, HFrEF. Question 8. Which of the following is a common sign of right-sided heart failure? A. Pulmonary crackles. B. Jugular venous distension. C. Tachypnea. D. Orthopnea. Answer: B. Jugular venous distension. Rationale: right-sided heart failure leads to increased venous pressure, causing jugular venous distension, which is a classic sign of this condition. Question 9. A nurse is monitoring a patient with heart failure on a sodium-restricted diet. Which food item should the nurse avoid recommending? A. Fresh fruit. B. Grilled chicken breast. C. Canned soup. D. Whole wheat bread. Answer: C. Canned soup. Rationale: canned soup often contains high levels of sodium, which can exacerbate fluid retention in patients with heart failure. Question 10. A patient with heart failure is prescribed an angiotensin receptor blocker (ARB). Which of the following is an expected benefit of this medication? A. Increased heart rate. B. Reduced fluid retention. C. Improved myocardial contractility. D. Decreased blood pressure. Answer: D. Decreased blood pressure. Rationale: ARBs help reduce afterload by lowering blood pressure, making it easier for the heart to pump blood. Question 11. Which of the following is a primary cause of right-sided heart failure? A. Chronic obstructive pulmonary disease, COPD. B. Coronary artery disease. C. Diabetes mellitus. D. Hypertension. Answer: A. Chronic obstructive pulmonary disease, COPD. Rationale: COPD increases the workload on the right side of the heart, eventually leading to right-sided heart failure due to increased pulmonary resistance. Question 12. What is the most appropriate intervention for a patient with heart failure who has increased edema and weight gain over the last 3 days? A. Increase fluid intake. B. Administer a diuretic. C. Start mechanical ventilation. D. Encourage ambulation. Answer: B. Administer a diuretic. Rationale: increased edema and weight gain are signs of fluid retention, so administering a diuretic is necessary to help the patient excrete excess fluid. Question 13. A patient with heart failure is experiencing orthopnea. Which of the following interventions would be most effective? A. Encourage the patient to lie flat. B. Elevate the head of the bed. C. Administer oxygen via nasal cannula. D. Restrict fluid intake. Answer: B. Elevate the head of the bed. Rationale: elevating the head of the bed helps relieve orthopnea by reducing pressure on the diaphragm and improving lung expansion. Question 14. A nurse is caring for a patient with heart failure who is prescribed spironolactone. Which of the following should the nurse monitor closely? A. Blood glucose levels. B. Serum potassium levels. C. Liver function tests. D. Respiratory rate. Answer: B. Serum potassium levels. Rationale: spironolactone is a potassium-sparing diuretic, and monitoring potassium levels is essential to prevent hyperkalemia, which can lead to dangerous arrhythmias. Question 15. A patient with heart failure has been prescribed a low-sodium diet. Which of the following should the nurse recommend? A. Processed meats. B. Fresh vegetables. C. Canned beans. D. Salted crackers. Answer: B. Fresh vegetables. Rationale: fresh vegetables are naturally low in sodium and are an appropriate choice for a low-sodium diet in heart failure management. Question 16. Which of the following is a common side effect of ACE inhibitors in heart failure treatment? A. Constipation. B. Persistent dry cough. C. Increased appetite. D. Weight gain. Answer: B. Persistent dry cough. Rationale: ACE inhibitors, like enalapril, can cause a persistent dry cough due to the accumulation of bradykinin. Question 17. What is the primary goal of using beta blockers in the management of heart failure? A. To increase heart rate. B. To improve myocardial contractility. C. To reduce heart rate and blood pressure. D. To increase fluid retention. Answer: C. To reduce heart rate and blood pressure. Rationale: beta blockers reduce the heart rate and blood pressure, which helps decrease the workload on the heart and improves overall heart function in heart failure patients. Question 18. A nurse is preparing to administer digoxin to a patient with heart failure. Which of the following should the nurse assess before giving the medication? A. Blood glucose levels. B. Heart rate. C. Potassium levels. D. Respiratory rate. Answer: B. Heart rate. Rationale: digoxin can cause bradycardia, so it is essential to assess the patient's heart rate and withhold the medication if the rate is below 60 beats per minute. Question 19. A heart failure patient is being evaluated for advanced therapies. Which of the following is an indication for the use of a left ventricular assist device, LVAD? A. Acute myocardial infarction. B. End-stage heart failure with refractory symptoms. C. Mild systolic dysfunction. D. Moderate hypertension. Answer. B. End-stage heart failure with refractory symptoms. Rationale. LVADs are used in patients with end-stage heart failure who do not respond to conventional treatments, often as a bridge to heart transplantation. Question 20. A patient with heart failure is experiencing worsening fatigue and decreased exercise tolerance. Which of the following is the most likely cause? A. Fluid overload. B. Hypokalemia. C. Renal failure. D. Hypoxia. Answer. A. Fluid overload. Rationale. Fluid overload can cause worsening fatigue and decreased exercise tolerance in heart failure patients due to increased workload on the heart and pulmonary congestion. Question 21. A patient with heart failure is being discharged with a prescription for a potassium-sparing diuretic. What is the nurse's primary concern? A. The patient may develop hypokalemia. B. The patient may develop hyperkalemia. C. The patient may experience dehydration. D. The patient may develop hypotension. Answer. B. The patient may develop hyperkalemia. Rationale. Potassium-sparing diuretics can lead to hyperkalemia, which can cause dangerous arrhythmias. Monitoring potassium levels is essential to prevent this complication. Question 22. A patient with heart failure is prescribed ivabradine. Which of the following is the primary mechanism of action of this medication? A. Reduces heart rate by inhibiting the F channel in the sinoatrial node. B. Reduces fluid retention by blocking aldosterone. C. Increases myocardial contractility. D. Decreases afterload by dilating blood vessels. Answer. A. Reduces heart rate by inhibiting the F channel in the sinoatrial node. Rationale. Ivabradine works by inhibiting the F channel in the sinoatrial node, reducing heart rate and improving symptoms in heart failure patients without affecting blood pressure. Question 23. A heart failure patient is prescribed warfarin. What is the nurse's priority intervention? A. Monitor for signs of bleeding. B. Monitor blood glucose levels. C. Ensure the patient receives a flu vaccination. D. Assess the patient's heart rate regularly. Answer. A. Monitor for signs of bleeding. Rationale. Warfarin is an anticoagulant, and the primary concern is bleeding risk. The nurse must monitor for signs of bleeding, such as bruising, bleeding gums, or blood in urine. Question 24. Which of the following is a common complication of heart failure that requires prompt nursing intervention? A. Stroke. B. Pulmonary edema. C. Gastrointestinal bleeding. D. Hypoglycemia. Answer. B. Pulmonary edema. Rationale. Pulmonary edema is a life-threatening complication of heart failure, characterized by fluid accumulation in the lungs, leading to severe shortness of breath and requiring immediate intervention. Question 25. A heart failure patient with a history of chronic hypertension is experiencing persistent cough, dizziness, and fatigue. Which medication may be causing these symptoms? A. Furosemide. B. Lisinopril. C. Metoprolol. D. Spironolactone. Answer. B. Lisinopril. Rationale. Lisinopril, an ACE inhibitor, can cause a persistent dry cough and dizziness due to its vasodilatory effects. This is a common side effect of ACE inhibitors. Question 26. A nurse is assessing a heart failure patient who has developed anasarca, severe generalized edema. Which of the following is the most likely cause of this condition? A. Excessive sodium intake. B. Overuse of diuretics. C. Poor circulation. D. Right-sided heart failure. Answer. D. right-sided heart failure. Rationale: anasarca is often caused by right-sided heart failure, which leads to severe fluid retention and widespread edema due to the inability of a heart to effectively pump blood. Question 27. A heart failure patient is receiving a low-sodium diet. Which of the following foods should the nurse avoid recommending? A. Fresh fish. B. Canned vegetables. C. Fresh fruit. D. Grilled chicken. Answer: B. Canned vegetables. Rationale: canned vegetables typically contain high levels of sodium, which can contribute to fluid retention in heart failure patients. Fresh vegetables are a better option. Question 28. A patient with heart failure is experiencing worsening fatigue and dizziness. Which diagnostic test is most useful in determining the cause of these symptoms? A. Electrocardiogram (ECG). B. Chest X-ray. C. B-type natriuretic peptide (BNP) test. D. Echocardiogram. Answer: D. Echocardiogram. Rationale: an echocardiogram is essential in evaluating heart function and determining the presence of structural abnormalities, such as valve dysfunction or reduced ejection fraction, which may contribute to the patient's symptoms. Question 29. A nurse is monitoring a heart failure patient receiving hydralazine. Which side effect should the nurse be most concerned about? A. Headache. B. Angioedema. C. Hypotension. D. Weight gain. Answer: C. Hypotension. Rationale: hydralazine is a vasodilator that can cause hypotension, particularly in patients who are volume depleted or receiving other blood pressure-lowering medications. Question 30. A patient with heart failure is on a sodium-restricted diet and is concerned about meal planning. Which food would be the best choice for this patient? A. Canned soup. B. Fresh fruit. C. Bacon. D. Frozen pizza. Answer: B. Fresh fruit. Rationale: fresh fruits are naturally low in sodium and are an appropriate choice for a heart failure patient on a sodium-restricted diet. Question 31. Which of the following is a priority assessment for a patient with heart failure who is receiving intravenous IV diuretic therapy? A. Monitor blood glucose levels. B. Assess for signs of dehydration. C. Monitor liver enzymes. D. Check the patient's pulse oximetry. Answer: B. Assess for signs of dehydration. Rationale: IV diuretics can cause dehydration and electrolyte imbalances, so monitoring for signs of dehydration, such as dry mucous membranes and low blood pressure, is crucial. Question 32. A patient with heart failure is experiencing dyspnea on exertion and orthopnea. What position should the nurse encourage for optimal comfort? A. Supine position with the head of the bed elevated. B. High Fowler's position. C. Lying flat on the back. D. Prone position. Answer: B. High Fowler's position. Rationale: high Fowler's position helps relieve dyspnea by allowing for optimal lung expansion and reducing the pressure on the diaphragm, which is particularly beneficial for patients with heart failure. Question 33. Which of the following is an important consideration when administering digoxin to a heart failure patient? A. Monitor blood glucose levels. B. Assess for visual disturbances. C. Assess the patient's oxygen saturation. D. Monitor the patient's fluid intake. Answer: B. Assess for visual disturbances. Rationale: digoxin toxicity can cause visual disturbances, including seeing yellow halos around lights. It is important to monitor for this side effect, which indicates a need for dosage adjustment. Question 34. Which of the following factors can exacerbate heart failure and should be avoided in patients with the condition? A. Increased physical activity. B. Excessive fluid intake. C. Reduction in salt intake. D. Regular sleep patterns. Answer: B. Excessive fluid intake. Rationale: excessive fluid intake can worsen heart failure by causing fluid retention and increasing the workload on the heart. Fluid restriction is a key component of managing heart failure. Question 35. A heart failure patient is prescribed a vasodilator. What is the primary effect of this medication on the heart? A. It increases heart rate. B. It reduces preload and afterload. C. It decreases myocardial contractility. D. It increases cardiac output. Answer. B. It reduces preload and afterload. Rationale. Vasodilators reduce the work the heart has to do by decreasing both preload and afterload, which helps alleviate symptoms of heart failure. Question 36. A patient with heart failure is showing signs of fluid retention. What is the first action the nurse should take? A. Increase the diuretic dose. B. Reduce the patient's sodium intake. C. Contact the healthcare provider. D. Encourage the patient to rest. Answer. C. Contact the healthcare provider. Rationale. Worsening fluid retention should be addressed by the healthcare provider to adjust the treatment plan, such as increasing diuretics or assessing for other underlying causes. Question 37. What is a common side effect of the diuretic furosemide in heart failure patients? A. Hyperkalemia. B. Hypotension. C. Hypercalcemia. D. Weight gain. Answer. B. Hypotension. Rationale. Furosemide is a powerful diuretic that can cause dehydration and hypotension due to the loss of fluid and electrolytes. Question 38. A nurse is caring for a patient with heart failure and a reduced ejection fraction EF. Which of the following is a key component of managing this patient's condition? A. Restricting all fluids. B. Increasing the heart rate. C. Optimizing heart rate and blood pressure control. D. Encouraging high-sodium foods. Answer. C. Optimizing heart rate and blood pressure control. Rationale. Optimizing heart rate and blood pressure is critical in managing heart failure with reduced ejection fraction, HFrEF, to improve cardiac output and reduce the heart's workload. Question 39. A patient with heart failure is receiving a new prescription for sacubitril or valsartan. What is the nurse's primary concern? A. Risk of hyperkalemia. B. Risk of orthostatic hypotension. C. Risk of gastrointestinal bleeding. D. Risk of arrhythmias. Answer. B. Risk of orthostatic hypotension. Rationale. Sacubitril/valsartan can cause hypotension, especially in the initial stages of treatment, so monitoring for orthostatic hypotension is crucial. Question 40. Which of the following assessments is most important for a heart failure patient on a fluid restriction? A. Monitoring electrolyte levels. B. Measuring urine output. C. Checking blood pressure. D. Assessing lung sounds for crackles. Answer. B. Measuring urine output. Rationale. Monitoring urine output is essential in assessing the effectiveness of fluid restriction and diuretic therapy, as it indicates fluid balance and kidney function. Question 41. A 70-year-old patient with chronic heart failure presents to the ED with worsening dyspnea, crackles in the lungs, and a weight gain of 3 kilograms over the last 2 days. The patient is also on a sodium-restricted diet and daily diuretic therapy. What is the nurse's priority action? A. Administer a higher dose of the diuretic. B. Increase sodium intake to balance fluid retention. C. Perform a full physical assessment and monitor vital signs. D. Contact the healthcare provider for possible hospitalization. Answer. D. Contact the healthcare provider for possible hospitalization. Rationale. Worsening symptoms of heart failure, such as weight gain and dyspnea, despite diuretic therapy, may require hospitalization for further management, including potential adjustments in treatment and close monitoring. Question 42. A patient with heart failure and preserved ejection fraction, HFpEF, is admitted with increased shortness of breath and fatigue. After assessing the patient, the nurse suspects an exacerbation of heart failure. Which diagnostic test is most appropriate for confirming this suspicion? A. Electrocardiogram. B. B-type natriuretic peptide, BNP, test. C. Echocardiogram. D. Arterial blood gas. Answer: see echocardiogram. Rationale: an echocardiogram is the gold standard for evaluating heart failure with preserved ejection fraction, HFpF, as it helps assess diastolic dysfunction and ventricular stiffness, which are characteristic of this condition. Question 43. A 65-year-old patient with heart failure presents with confusion, restlessness, and elevated blood pressure. The nurse suspects that the patient is experiencing acute decompensated heart failure. Which of the following interventions should be prioritized? A. Administer oxygen therapy and assess respiratory status. B. Increase the patient's fluid intake. C. Administer oral beta blockers for rate control. D. Encourage the patient to ambulate to improve circulation. Answer: A. Administer oxygen therapy and assess respiratory status. Rationale: acute decompensated heart failure can cause hypoxia, and the priority is to improve oxygenation and assess respiratory function, especially if the patient is showing signs of respiratory distress. Question 44. A patient with heart failure is taking a combination of sacubitril or valsartan and spironolactone. The nurse notes the patient's potassium level is 5.6 milliequivalent per liter. What should the nurse do next? A. Continue with current medication regimen. B. Hold the next dose of sacubitril or valsartan and contact the healthcare provider. C. Increase the dosage of spironolactone. D. Administer a potassium supplement to correct the low levels. Answer: B. Hold the next dose of sacubitril or valsartan and contact the healthcare provider. Rationale: a potassium level of 5.6 milliequivalent per liter indicates hyperkalemia, which can be exacerbated by both sacubitril or valsartan and spironolactone. The healthcare provider should be contacted to adjust the medication regimen and prevent life-threatening arrhythmias. Question 45. A heart failure patient is being evaluated for possible heart transplantation. The healthcare provider orders an endomyocardial biopsy. What is the primary purpose of this test? A. To assess myocardial ischemia. B. To determine the presence of myocardial fibrosis. C. To evaluate for active infection or rejection in the heart. D. To measure the ejection fraction. Answer: C. To evaluate for active infection or rejection in the heart. Rationale: endomyocardial biopsy is used to assess the presence of active infection or rejection in patients considered for heart transplantation, particularly those with advanced heart failure. Question 46. A 60-year-old patient with heart failure is receiving a continuous IV infusion of nitroprusside for blood pressure control. After an hour, the nurse notices the patient's skin becomes flushed and the blood pressure decreases significantly. What should the nurse do first? A. Increase the infusion rate of nitroprusside. B. Administer an antidote for cyanide toxicity. C. Monitor for signs of systemic vasodilation. D. Discontinue the nitroprusside infusion and notify the healthcare provider. Answer: D. Discontinue the nitroprusside infusion and notify the healthcare provider. Rationale: nitroprusside can cause cyanide toxicity, especially with prolonged use. Flushed skin and significant hypotension are signs of toxicity, and the infusion should be stopped immediately. Question 47. A patient with heart failure and chronic kidney disease presents with fatigue, confusion, and an elevated creatinine level. The healthcare provider orders a diuretic. What is the nurse's priority assessment before administering the medication? A. Assess potassium levels. B. Monitor the patient's weight. C. Assess lung sounds for crackles. D. Review recent renal function tests. Answer: D. Review recent renal function tests. Rationale: in patients with chronic kidney disease, diuretics can exacerbate renal impairment. Monitoring renal function tests is essential to prevent worsening kidney failure. Question 48. A 72-year-old heart failure patient is being discharged with a prescription for digoxin. Which of the following instructions should the nurse include in the discharge teaching? A. Take digoxin only when you feel short of breath. B. Contact your healthcare provider if you experience nausea or vision changes. C. Avoid eating foods high in potassium while taking digoxin. D. You can stop the medication if you feel better. Answer: B. Contact your healthcare provider if you experience nausea or vision changes. Rationale: nausea and vision changes, for example seeing yellow halos, are signs of digoxin toxicity. The nurse should instruct the patient to contact the provider if these symptoms occur. Question 49. A 56-year-old patient with heart failure is admitted with acute decompensation and is being treated with a combination of IV diuretics and vasodilators. Which of the following assessments is most important during the first 24 hours of treatment? A. Monitoring for signs of arrhythmias. B. Assessing for signs of fluid overload. C. Monitoring blood pressure and renal function. D. Measuring oxygen saturation levels. Answer: C. Monitoring blood pressure and renal function. Rationale: IV diuretics and vasodilators can affect both blood pressure and renal function. Close monitoring of these parameters is critical to prevent hypotension and worsening kidney function. Question 50. A heart failure patient is being discharged and is prescribed a beta blocker. What should the nurse emphasize when teaching the patient about this medication? A. You should take this medication only when you are feeling fatigued. B. This medication can cause a decrease in heart rate, so monitor your pulse daily. C. If you miss a dose, double the next dose to make up for it. D. You should stop the medication if you experience dizziness. Answer: B. This medication can cause a decrease in heart rate, so monitor your pulse daily. Rationale: beta blockers can cause bradycardia, so patients should be instructed to monitor their pulse daily and report any significant decreases in heart rate to their healthcare provider. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.